We have based the Congress on two keywords, engagement and excellence. Today is the first day for the European Society of Cardiology Congress 2019 in Paris. We are very excited to welcome delegates. The numbers of attendees has overpassed the 32,000 this very first day, and we are waiting for more delegates to come and join us. We have a lot of new initiatives at the meeting. We have based the Congress on two keywords, engagement and excellence. Engagement means that we really want everybody, every interest that a cardiologist or a cardiovascular doctor has in his career and in his practice to find an answer, a session that will attract him. So in terms of engagement, we have a program called 4 Days in Cardiology, and it's a program that in 4 days really performs an overview of all the key topics for management of patients with any cardiac disease. We have sessions that are very practical and connections live to hospitals in Europe where procedures are performed so that clinicians can see the world expert really performing procedures like valve replacement percutaneously, coronary artery management with PCI, complex abrasions of ventricular tachycardias. We also have for the practice the engagement of our community by several sessions with presentation of clinical cases for discussion. We have sessions in which the really most debated topic are brought to the front line in sessions dedicated to the most debated issues in cardiology, where the expert will be able to discuss their point of view so that the attendees can make their opinion on how to deal with patients with these issues that are still uncertain how to manage. Finally, when we talk about excellence, we are very proud that the meeting that we are organizing is not only global, meaning having delegates from all over the world in terms of attendees that are focusing on their formation, training, and learning, but especially the fact that we have excellent scientists from all over the world that will be reporting their breaking news in terms of basic science, translational science, clinical science, and applications of genetics to the clinics. In this respect, we are very proud to have a very intense and challenging hotline sessions where we will have important trials in all the fields that we are covering. I want just to mention in particular that in heart failure we will have the results of the Paragon HF trial with over 44,800 patients with heart failure and preserved ejection fraction that will give an answer on the result on prevention of worsening of heart failure and mortality of sacubitril and valsartan. Similarly important, we have the results of the DAPA-HF that will give an answer on whether dapagliflozin is a SGLT2 inhibitor will be able to have a benefit in heart failure in patients with and without diabetes. Just to point out one thing that is kind of an innovation, we have for the first times really a sessions dedicated to trials in which genetics is being incorporated in clinical management of patients. In particular, the popular genetics is a study in which genotyping guided P2Y2 inhibitors in patients with STEMI will be assessed, and the concept that we are really at the frontier by being able to probably discriminate the patient's management using genetic factors, is definitely an innovation that will change the practice of clinicians and also the aspect that the clinicians should learn. In this respect, we have also an important report from the UK Biobank where we will see again a randomized trial on lowering LDL and reduction of lifetime cardiovascular diseases based again on the molecular substrate that the patients have in their genetic profile. So I think that in a brief summary, what we want to cover with our Congress is really the needs for the physicians who is in practice, the need of the physicians who is in practice and wants to keep an eye on innovation, and the needs of those that are engaged in the most challenging development and frontier of the science. So we hope that the meeting will be exciting for everybody and will leave everyone energetically engaged for the rest of the year.